Hello, my name is Dr. Jill Zimmerman and I am with Elevate Coaching Mentorship. Okay, so what we do is we help coaches understand what is happening in their clients, especially some of these hard to treat clients. Okay, so I'm a physical therapist. I really specialize in helping people overcome specific pain issues. One of those issues that may show up in your clinic as a PT or may show up at your gym as a trainer or some other kind of movement specialist is hip impingements, okay? I made a video earlier about opening up space in the front and the back of the hip. Today we're gonna be talking about opening up space in the side of the hip, okay? Now this is not just something I would do for somebody with hip impingement, but this is the way I think about things when I am looking at anybody who seems to be running out of space in the hip, okay? And so we're gonna be using one of our main principles that we talk about in Elevate Coaching Mentorship to explain this, and that is dissociation of movement, okay? So getting certain parts of the body to move independently from others, okay? In this case, frontal plane, okay? So what am I even talking about here? Okay, well, I'm talking about how do we abduct and how do we adduct the femurs, okay? And how do we do that without involving the pelvis, okay? And then also, how do we move a pelvis around a more stationary femur, okay? So one of the things that I'm gonna look at initially, okay, is going to be sort of like, and you've probably done this with your clients, but what is their ability to sort of move a leg out to the side without their entire pelvis tipping? Okay, so it's a nice, easy before and after test. You can see on this side, I'm struggling a little bit, okay? Feeling a little tension in these adductors, okay? As my femur's moving off to the side, it's taking my whole pelvis with it, okay? And guess what? I'm dealing with a little bit of right SI, right hip issues right now. So maybe we should work on this, okay? On the left side, I'm actually able to move this left leg pretty independently and stay equally heavy on the back of my pelvis without much issues at all, okay? So this is a nice test that you can do with your clients. Now we want to clean it up, right? So what I'm going to do is I'm going to add a reach here to really just get the whole core system integrated. So we're going to reach, take another breath in, take a breath in, and then let it all the way out. Now I'm staying nice and long through my spine and I'm cueing a more neutral pelvis. So I don't want the client to be totally tucked under. I want a nice long neutral pelvis, okay? And then I'm just gonna start and say, okay, can this person just pick up their right leg without this tipping or any kind of weird hiking going on? And if they can't, how can I adjust that for them? Okay, so if they're struggling, I might say, okay, if they're starting to kind of tip the pelvis up like this, let's just keep this pubic bone reaching long that way. As it's reaching long that way, I want you to really reach through here and exhale and let all those ribs come together and down towards the floor, staying nice and long. Okay, I might cue for them to get heavier on the back side of this left pelvis if that's the one that seems to want to lift up. And I may cue a pull or a drag with the hamstring of the one that we want to dig into the ground a little bit more, okay? For me, that's the kicker, okay? Now I'm feeling really connected on the back of this pelvis. So sometimes you gotta play around with a couple cues, whether it's more reach, reposition the pelvis, or use some muscle energy to anchor and ground the pelvis, because that's all we're trying to do. We're trying to ground this pelvis so this leg feels free to move, okay? If this pelvis doesn't feel anchored, if it doesn't feel grounded, this femur's not gonna wanna move by itself, okay? It's gonna be scared. It's gonna be like, no, nothing's holding us, okay? So we get anchored and now we can move, okay? And now I can let this femur abduct, and then adduct without much movement here at the pelvis, okay? So I'm just gonna check, can you do that? Can you get better at that? Can we get the motor control pattern here to put the reps in to make this more of a normal pattern for this client, okay? So that's where we might start, okay? So we're moving the femur independently of the pelvis, okay? Okay, so then you might bring somebody on hands and knees here, okay? And you might say, okay, now let's see if the pelvis can move side to side. Okay, so I'm allowing that pelvis to shift across the room, lateral to my knee here, okay? And then I'm going to shift over to the other side. Now I'm trying to really allow the pelvis to do the moving, okay? Versus spinning with my shoulders, okay, and letting my whole body spin, which is not really getting my pelvis to go that way. It's just getting my upper body to go that way. So I'm not really weight shifting onto this side, okay? So you're allowing your pelvis to move that way, okay, without hiking or like turning like I said, okay? So just going side, creating space in the lateral hip, and then side, okay? So as we move to the outside, we create space here, okay? I'm getting space on the outside of the right. I'm getting space on the inside of the left, okay? As I go over to the other side, I'm going to get space on the outside of the left, and I'm going to get space on the inside of the right. So I'm really able to isolate the pelvis now, moving over a closed chain femur, okay? So the first exercise was open chain. Second exercise is a little more closed chain, but we're not on our feet yet, okay? So a little bit lower level. Anybody can do this, and then you can get people up on their feet. Okay, so now we're up on our feet, all right? We're gonna do the same thing we did on the ground, where we let the pelvis move from one side to the other, okay? I'm letting one knee bend forward, the other leg is straight, bend a knee, straighten a leg, okay? So all we're doing here is we're letting this pelvis move side to side, same rules apply, okay? We're not spinning into this, okay? We're not pushing out with a knee, okay? We're not overly hiking a hip, okay? What we're doing is we're allowing our bodies to stay square to the front, okay? And allowing the chest and the pelvis to move center of mass over and onto one foot. Feel yourself get heavy and over and centered and grounded on that foot. Getting space out here, getting space in here. We're gonna push down. Other side, getting space on the left now, outside, back, and we're getting space inside, right. Okay, so we're just truly allowing for space to occur, okay? If we cheat, okay, if we spin in, we are wiggling around creating that space, okay? We're not allowing the femurs to actually move in that pelvic socket, okay? We're cheating out of it. We're spinning. We're like, okay, everything's gonna move as a block now. I can't articulate, so I gotta find another way to get over there, okay? But if we clean it up, okay, we will truly allow for more isolated movement of the femurs in the pelvis, okay? When we hike, overhike in these situations, okay, again, that is a way to wiggle out of it, okay? That's a way to wiggle out of really internally rotating into this hip. Okay, we can just, I'll just use my, my side body here. I'm just gonna tap into my QL, all right? And I don't have to actually create space in the side or back of my hip. I'm just gonna lift it all up, okay? So just sort of paying attention to what some of these common movement compensations are, which are just, they're just strategies. Okay, they're just strategies because the options are not available. Okay, so all we try to do in Elevate is go off of these principles to help you understand what you're seeing in your clients and what to do about them. So understanding what dissociative movement is, what it looks like, what it doesn't look like, what the strategies are instead, okay? Understanding how to create do some sensory exercises and then turn those into motor control exercises, then add some complexity onto those movements to really build a client from the beginning and not have them just get stuck at the beginning, but move them through a sequence that gets them up on their feet and moving the way that you want them to. Okay, so I appreciate you guys watching. If you have any questions, stick it in the comments section and we will get to it.